Welcome to TT Online Community Voices, where we equip you with information to make informed decisions on a plethora of topics as it relates to you. This afternoon, prepare yourself for a bit of a crash course on the COVID-19 pandemic. We'll be exploring perspectives from first-hand accounts and medical experts. As joining me this afternoon, I have the esteemed pleasure of Dr. Earl Otley, a COVID-19 consultant attached to the Cora Hospital, joining me this afternoon. So thank you for joining us. We are also joined by Fleur Tam-Noel. Dr. Fleur Tam-Noel is in terms of primary care and will give us some insight into our day-to-day handlings of the COVID-19 virus and more. And it would be incomplete if we didn't hear firsthand the experience of Christopher Allen. He is in fact a COVID-19 survivor and pro-vaccination advocate. So lady and gentlemen, again, welcome and thank you so much for joining the discussion.
Thank you. Thank you.
Now, the intention is that by the time we're through, our viewers online and at home are able to decide what is best for themselves, their family members, and of course, how they operate in society as it relates to the COVID-19 virus. And I think that entails us demystifying and debunking some common misconceptions, starting with you, Dr. Otley, telling us what exactly is COVID-19.
All right. So good afternoon, Anchor, and to Trinidad and Tobago, and to all who would view and see this airing. COVID-19 is a condition, a disease that we know that is responsible for the pandemic now. It's caused by a virus, which is a coronavirus. It's named SARS-CoV-2 virus. It was related to the previous SARS-CoV virus in that it was so similar to it, hence the name SARS-CoV-2. And so that virus, once it causes infection, it can lead to the disease, which is called COVID-19.
Okay. Now, when we talk about COVID-19, we've heard of variants and versions, none of which matters because ultimately they carry the same symptoms and can end the same result, yes?
Correct.
So let's explore some of the basics. What are the symptoms that we should continue to look for?
Right. So the COVID-19 disease caused by the SARS-CoV-2 virus, the symptoms are very similar to the cold and to the flu and so on, right? So it's the type of symptoms that you would experience would be things like cough, shortness of breath, you may have some runny nose, you may have some chest pain, right? Fever. These are the major types of symptoms that exist with the SARS-CoV-2 virus. And it's the same for all of the variants that exist. And by variants, what it means is a variant is just a different strain of the particular virus. So regardless of what strain it is, the symptoms are all similar.
Right. That's very important because as much as the thought process is the variants can be more or less severe, the fact that they have the same symptoms means you still need to exercise the same cautions, still need to protect yourself, and you still may need to be checked and look at additional care and different ways of managing it. Now I'm going to jump across to Christopher because in the case of having contracted the virus itself, your experience is very important to be expressed. What was your first indicator of you contracting COVID-19?
Okay, good afternoon, everybody. I distinctly remember I was on my way home and basically it started with a cough, excessive cough. That was unusual. And that was around probably 5 o'clock. And by 9 p.m., I realized there was a fever. And a couple hours therein, I jokingly tell people that at midnight, if you had cracked an egg on my forehead, it would fry. Wow. And it got progressively worse.
Very quickly.
Very, very quickly. And then at around 4 a.m., I realized I was having problems to breathe. And everything happened so quickly. So I called the ambulance and they came and they took me to Mount Hope. There I was swabbed and I was unfortunately told I had COVID. I had to wait a little while because, at Mount Hope, space is a premium.
Right.
You know, I got there around maybe 6 o'clock, and I was not taken inside. I have to call it a makeshift temporary outdoor hospital.
Right.
Somewhere around 11 o'clock.
This is all in the evening.
11 o'clock, the very morning.
Okay. In terms of the time frame, this was how recently?
This happened in the latter part of May.
Okay.
Probably around the 20th, 21st of May.
So that the hospital capacity and other details to your experience may change for persons who are more recently involved, but this was yours at the time.
Yes.
Can I ask then, in terms of the contracting, was it ever determined how or where, perhaps? Would you have said that you've done anything outside of the protocols to avoid?
Well, actually, it's ironic because I always saw myself as being overly careful. Washing hands, wearing a mask all the time, trying my utmost to stay away from crowds, even rescheduling my visits to the supermarket, going very early instead of going to the times when it was crowded. But I will tell you this. I would frequent my sister's home, mostly on weekends.
Okay.
So probably somewhere between there and maybe externally, probably I contracted it. But for some reason, I would tend to lean towards maybe there because unfortunately, both my sister and brother-in-law both contracted and passed. And their sons, we all got it. Fortunately for them, they were what they call asymptomatic, having it and not showing any symptoms.
Right. So we will explore in a little more depth the experience of not just yourself, but family members contracting. But to be more precautionary, Dr. Tampnell, I'd like to ask, in the case of someone who's being extra cautious, as he says, what are the steps that we can take to continue to be extra cautious? Even though we are seeing here, it doesn't guarantee that we're going to avoid the virus.
Important when dealing with COVID-19, you have to think of the various bubbles we may be in. Even though somebody may be in a certain bubble at home or at work, it's important to other people that you don't, even though it's family members or people who are normally very close to you, that you still maintain, because remember, they are coming from another bubble. They may be at a work bubble, and you can't monitor their activities 24/7.
Right.
So I think it's a case of not letting your guard down and taking all the necessary precautions. So if you go visit a relative, say you have to, you continue to wear your mask. I would recommend you wear your mask, you try to social distance, because there are a lot of entities we cannot cater for.
Right.
So that is important. I think when you go out, just be conscious. So when you come home, there are certain things really you need to practice.
Like?
So like if you come home from work, there should be an area where probably if you went to the grocery or you brought things, your bag, that sort of area where you put it.
Mm-hmm.
And you should, to some extent, try to sanitize it if you're going to bring it in any further, even like your keys, sanitize that. If you can have the facility where you can probably take off your clothes and go to bathe one time. Mm-hmm. In terms of grocery items that you bring home, where possible, you can wipe down with disinfectant before you store it away. Even when you go to places like the market, as much as it's feasible, if you have fruits, you wash it. Soap and water is amazing. It can be a bit tedious,
right? But
you just have to sort of make a conscious effort. And especially if you have children. So say you work in a health environment and then you're going home to your children and your children are at home all the time. You have to be very careful of doing certain sanitary precautions before you enter into their bubble. So
now, of course, the basics we know: wearing a mask, physically distancing, and of course, washing your hands with soap and water as much as possible, sanitizing being another option. But are there additional precautions or additional steps perhaps we need to inculcate into our daily routines that we may have missed?
Okay. So like a lot of high-touch surface areas, doorknobs, light switches, taps that we need to regularly disinfect, if even twice a day with some disinfectant water, or the recommendations are a third a cup of bleach in a gallon of water. If you have items, but an easier way to remember, if you have a disinfectant, you dilute it and you use that to sanitize. If you have your fruits or vegetables, where possible, wash it, or even before you use it, wash it, that sort of thing. The clothing that you wear outside, you take that off as much as possible. Have a shower. Even items that you buy, I know it may be a bit tedious, wipe those down before you bring them in. Trying as much as possible to keep a clean environment. I know it can be quite stressful because a lot of people not just dealing with COVID, but there are a lot of psychological issues that go around, and being motivated to maintain this can be quite challenging. So,
but don't worry, we're going to equip them with as much information as they need to make that process much more simplified. Because you can also speak to the advantages and disadvantages, the complications of at-home care. When we talk about getting into noticing the symptoms, being diagnosed, or even just self-quarantine because you suspect, there ought to be some steps that we should take therein as well. Can we explore those then, Dr. Tam?
Sure. So if you are, so firstly, there are two terms that we use, quarantine and isolation. Quarantine is used if you are suspected you may be COVID positive. It's not confirmed.
Right.
So we use the term you go into quarantine. Isolation is used if you have been confirmed that you are COVID positive.
Right.
And you need to isolate away. It's sort of similar in what you have to do, but the terms, once you hear isolation, the person is COVID positive. Quarantine, there is a possibility they're suspected, whether they've been swabbed or they've just been told to maintain this quarantine period as a safe period so that once it finishes, it will be safe to return into normal society.
Right.
So if you're in quarantine, firstly, if you're in quarantine, we advise you, obviously people live in different sort of homes or apartments, so space can be limited.
Right.
As much as possible, the person under quarantine try to live in one particular area of the house, as feasible that is. If it's possible for them to use a separate bathroom and toilet, do that. Separate utensils, dishes, that sort of thing. If there has to be sharing of bathrooms, we would recommend that you clean the area after use and before someone else uses it. Cleans that area. Usually, if somebody is swabbed, or especially if somebody is swabbed, the protocol is their entire household needs to go into quarantine too. But as much as possible away from the person who is swabbed. So even though, there may be 5 people in a home who are quarantining, but with particularly the person who may be symptomatic or at higher risk, it's important that they try to quarantine as much as possible away from. But this can be challenging, especially if maybe you have children.
Absolutely.
And maybe you're a main carer. So there are lots of
complications therein.
Yes.
Let's get into some of those, Dr. Audley, because in your capacity, you may be able to give us some specificity as to perhaps what we can do once we are in fact isolated from our family members, where before rather we end up into any of the facilities of hospitals or so. Are there actual things that we as individuals can do?
Right. Well, as Dr. Tam mentioned already, she mentioned quite a few of them already. In addition to what she mentioned, things like keeping the windows open so that you can ensure that there's air passing through, as opposed to viral particles staying in an enclosed space and increasing the risk to the other person.
So no AC.
No AC.
Fresh
Open
air
the windows, fresh air. We go all the way back. Additionally, we have the person should do the general things that they would usually do. So we speak towards adequate nutrition. So ensure in particular that you're hydrated, because just like other ailments, you tend to lose appetite. And so in particularly the elderly, they stop drinking, you can't get them to drink. And so that can go on to other problems that will cause that person to end up in hospital, require admission. So in general, you need to ensure that your diet is balanced, and that even if you can't take in food as you regularly would, ensure that you're taking as much fluids as possible. And where exercise can be tolerated, you do some level of exercise rather than just remaining immobile during the course of the
Fight it.
illness. Yeah.
Keep moving. Now, Christopher, we have to come back to that phase to come. So that your experience, once you were tested positive and you knew in fact this was the case, would you have explored any of those steps that he mentioned? Started cleaning even more, perhaps isolating yourself from family. What was your next step?
Well, when I was diagnosed as being COVID positive, um, I distinctly remember being very weak, and I could hardly breathe. I could hardly speak. Doc just spoke about something there, the loss of appetite. My 5 days at Mount Hope before being transferred to Hoover,
Mm-hmm.
I remember distinctly having 2 sips of Insure. 2 sips of Insure
And that's it.
in probably 4.5 days. You know,
So the ability to actually consume anything is not even there. The desire to is not there. It's definitely now a mental battle to keep yourself going.
Correct. Correct. You know, but because you're so disoriented, you know, there's not the urge to eat anything at all.
Right.
You just sometime you may feel to take a sip of water, but other than that, as Doc just said, there's no appetite.
Now, Dr. Lee Crystal is mentioning specifically being transferred from one location to the next. For the average man on the street, your process is usually to go to your nearest health facility. You get your testing, you are diagnosed. What happens next? Is there a different location depending on the severity of your ailment?
All right. So just to go back to a person who tests positive, and just to caveat in here, testing positive, what is diagnostic of COVID-19 in Trinidad and Tobago is a PCR test.
Right.
Now before we had serology tests, that's the blood test. That is not diagnostic.
Right.
In fact, it's not that helpful at all.
Okay.
And now we have the rapid antigen test, which you can get back the result in 15 minutes, half an hour, depending on which type you have. And that is not diagnostic either. So even if a person goes to a private facility or even in the public health system where it's used to screen person to kind of triage and determine what's the likelihood of this person actually being COVID-19 positive, it's still not diagnostic until you have your PCR result that says that you're positive.
And PCR testing is the entire swabbing and the complexities there.
Yeah, so it's where you test. You swab in the nose. The rapid antigen test is the same swab in the nose as well.
Okay.
But the test is a different test.
Okay.
Right? So sometimes a person goes and they go to a private facility and they get a rapid antigen test done. And then they find that it's positive, and then they start isolating and so on without understanding that they're still not being considered positive until you have a PCR test done.
Okay. So to make the distinction, is that something that we can individually request, one or the other, or it's determined by the healthcare facility which is issued?
So if you, for any reason, are going to be suspected of having COVID-19, you should have a PCR test. Whether you do it privately or if you come to the public system, you'll be tested via PCR to determine if once you've been suspected, to determine whether you are in fact confirmed COVID-19 positive.
Okay. So PCR test is done. What next?
Right. So if the patient is well, which Dr. Tamnoa spoke to, those persons are allowed to isolate at home.
Right.
And they will be followed by the county medical officers of health. Right? And they're doing an excellent job with regards to that. Right now, I suppose we have like 5,000 persons at home, and they're monitoring those persons, daily calling them and following up. So if during those follow-up, they find that the persons, there's something that is alarming, meaning that they find that they're having more shortness of breath.
Right.
The person, they're difficult to communicate with the person over the phone. They can't complete sentences. Right? They're complaining of symptoms that, like, for example, severe chest pain, right? If they're also given a Spo2 monitor, advised to get an Spo2 monitor, that's they call a pulse oximeter, the machine that you put on your finger that tells you your oxygen levels. And if you're falling below 94%, that usually is a flag for the CMOH, or they advise the person that if they see that lower than 94%, that they should call the ambulance 811 directly, and they would come and assess them.
Okay.
So at that point, if they have any of those red flags, then they would come to the hospital. So in our system, at least within the NCRHA, the COVID-19 hospitals are Quora Hospital, Hoover Hospital, and Arima General Hospital.
Right.
So Quora, we generally see the mild to moderate cases, and some severe, but the more critically ill persons, the severely ill persons, they tend to go to Hoover or to Arima General.
Of course, depending on the location and proximity. So
Once it's within the NCRHA catchment.
Makes sense. I ask this because there are so many myths, so much assumption, so many Google experts giving wrong information that it's important to understand the chain or the process and not cloud the system as it already is overwhelmed, making sure that they continue to have success stories like Christopher. Now, you have survived a very traumatic experience, but you have family members who were not so fortunate. I must ask, is it that your sister who would have passed, would she have in any way been part of your caretaking team or given care to you at all?
No, actually, both my sister, brother-in-law, and myself, we were all hospitalized on the same. No, my brother-in-law was probably a couple of days before.
Okay.
And both my sister and myself, we were on the same day. The last time I saw them was the Sunday before. Now I knew for some reason, and God forbid I'm saying this, the moment I heard my brother-in-law had contracted COVID, I was a lot more concerned for him because he was a dialysis case. And I remember my sister kept saying, there's one thing you cannot contract is COVID because of the delicate situation that you're in.
Day-to-day life, right?
I was a little surprised about my sister though.
Okay.
Unfortunately, while I was in transit between Mount Hope and Hoover, she had passed. She was in the Arima facility, Arima Hospital. I hadn't known because I was advised by the doctors not to tell me anything.
Right.
I didn't know until the Sunday, unfortunately, through a WhatsApp message.
Now, that in itself requires another set of care, another set of coping, another set of support that I imagine beyond your family, therapy, and more.
Ironically enough, I have to compliment the 3 doctors, one at Mount Hope and the 2 doctors who saw about me at Hoover, Dr. Rouse and Dr. Ragbir. They were fantastic. And Dr. Shurat Singh up at Hoover, at Mount Hope.
Why do you say so? What made them fantastic?
Because of their caring, approach. They took time out to explain everything to you. Exactly what is happening and the procedures they have to take. I remember one in particular. Doc just mentioned the gizmo that they place on your finger to check the blood oxygen.
Right.
I had gotten to a stage where they had to go into my wrist to extract blood. That is a very excruciating amount of pain, because when I remember getting to Hoover. No, actually, I woke up and realized I was in Hoover because having left Mount Hope around 10:30, 11ish, the only thing I remembered was passing Grand Bazaar, passing the Carney Bridge, and I blacked out. Next thing when I opened my eyes, it was 6:47, and I was lying in Hoover, totally disoriented. Not having a clue where I was.
So the doctors would have helped you through that process in terms of informing you and keeping you abreast of what's happening as much as you
Sure.
so that you're mentally able to navigate and move forward. To the point of being pro-vaccination, which is something we'll come to shortly. But in the case of persons who are not just there, Dr. Tamnuel, I do need you to tell me what the care for a person who has been tested positive, who is in treatment, and who is not able to get vaccination because of that positive test would be like. What does the hospital do or the institutions do that they should be mentally preparing themselves for? More blood tests, as we say, more invasive things, or are we continuing to be treated with fluids? What exactly happens?
I mean, when they're actually, say, at Cora, if
Right.
they're in hospital, or once they're discharged?
Cora first, discharge thereafter.
Okay, so normally, if they're improving, they would do supportive therapy. They would hydrate them. They would make sure that there's no sort of underlying, like chest infections, that sort of thing. So they may have to have chest X-rays, serial X-rays. If it's like some sort of infection, bacterial, they need to be treated with antibiotics. They may consider if there would be some benefit in treating them with steroids too, that sort of thing. Once they're improving, there is the facility where they can go into a step-down facility.
Right.
It would be somewhere close to where, within their vicinity.
Mm-hmm.
So it means that technically you're improving,
Right.
but you're not well enough to be discharged home.
Right.
So they would be monitored there, and that is run by healthcare professionals, doctors, and nurses.
Right.
The patients are a bit better there. And then once they believe that you're well enough to be discharged, then you'll be discharged home.
What is your care and your behaviors once you're discharged then?
Okay, so really and truly, once you're not in an the infectious period has finished,
Mm-hmm.
and you're well enough to be like fit to work,
Right.
all right, we would issue the CMOH office, or in the case of, well, mostly it will be the CMOH office,
Mhm.
will issue you a fit to work when you're ready, well enough to be fit to work. You'll be released from isolation and
Mhm.
also issue you a fit to work. And in terms of guiding you, obviously you've just been through quite a challenging period, mentally, physically.
Mm-hmm.
So in terms of you need to look after yourself, probably a little less stressful life that maybe you were living before.
Mm-hmm.
Take better care of your health, get enough rest, eat properly, get enough sunshine, manage your stress, that sort of thing. Don't put yourself at unnecessary risk
Right.
for possible reinfection. Continue to follow all the protocol guidelines.
Okay.
In terms of vaccination, really there is a cooling off period of 3 months
Mm-hmm.
after you're infected before you can be eligible to be vaccinated in one of the vaccines that is offered.
Do you then go through an assessment before you are vaccinated as somebody who has tested positive, or can you go into the centers?
You
as
can
the
go
general
into the
public does?
centers. I mean, the sheet that you're given really assesses if you're well on that day and
Mhm.
you're not at risk of, say, having COVID,
Right.
that sort of thing. And also they would ask you to, if you've ever tested positive,
Right.
and also when did this happen, that
Okay.
sort of thing. And
So
then
that helps to determine whether or not they'd go forward.
and then
Right.
the form is assessed. You are asked a few questions to make sure that you really are eligible to be vaccinated.
Right.
And it's not a problem. Once you meet the criteria and you tick all the right boxes in terms
Right.
of you qualify,
Quite literally.
yes, you would be administered the vaccine.
Okay. Now, Christopher, that must have been quite the experience, having survived, and now that period is past. What was the convicting point at which you decided, I'm definitely going to be pro-vaccination?
When I had the unfortunate experience of seeing, inclusive of both my sister and brother-in-law, 11 people die.
Within your circle of friends and family?
Within the confines of the between Mount Hope
Ah,
and Hoover. What is ironic, out of those persons, I was the only person who was vaccinated, who survived. The only person. The other 9, especially, take for instance, the guy who was opposite to me, we would chat from time to time, one word, because you're
Right.
wearing this mask and you could hardly breathe. So, you could just exchange one words. And he was against being vaccinated. And
didn't
yet
make
he
it.
succumbed. I had the unfortunate of seeing others in Hoover who hadn't been vaccinated. And I kept asking myself, you are here because 1 month prior to contracting COVID, I got the AstraZeneca. And those persons who I'd seen passed away hadn't been vaccinated.
So it absolutely was an indicator
Yes,
of the, well, advocacy we're seeing now.
I would assume.
Now, Dr. Hartley, I asked these questions in terms of the process, as detailed and as drawn out as it may sound, because there are a lot of misconceptions still, despite the numbers, despite the statistics, despite these first-hand accounts. We have the opportunity to learn a lot in terms of our medical community anyways, and we have the opportunity to continuously consult with other doctors abroad, other countries, regionally, internationally, and so on. I imagine this is incredibly stressful and not happening fast enough because we're still seeing the numbers. So my reason for going through all these details is to perhaps save you from going through what your day is like, what your process is like daily. But I still do need to know, on average, are we still seeing those numbers climbing in terms of intake of patients, in terms of persons we are losing, in terms of recovery? What are we talking about statistically?
Right. So currently, as we're seeing on the press conferences that happen weekly, we're seeing the numbers, and they're more or less holding right about now, right? Which is good, but what we want is better. And best actually. And best is actually for it to come all the way down, right? As I mentioned, we have whether it's 4,000 or 5,000 active cases. These are people in home, well, across the island currently. So we have a lot of people between Trinidad and Tobago who are currently still infected. So we would want to see those numbers come down, and we're still seeing on a daily basis cases that are around the high, close to 200 new cases every day.
Okay.
Right? And also, as has been reported, we're seeing also more children at this point in time.
Right.
Right? So what we do know is just, it's considered similar to, like you see people walking towards a cliff as he was, and we know that we have a tool that is available. The last time we went through anything as significant as this would have been the 1918 pandemic, 1918-1919 pandemic, which was dubbed it was an influenza pandemic, dubbed the Spanish flu. Right? We try to stay away from names that are associated with nations and that way because of
the stigmas that
are accompanied. And in that case, somewhere close to 100 million people died. Currently, in the space of 20 months, we've lost 4.5 million people who have died with COVID-19. Right? What we do have in this age that wasn't available in 1918 is vaccine. So we have vaccines that have gone through the testing. We understand that persons are concerned because of how fast the vaccines came about.
A big argument, which basically discredits medical advancement.
Yeah. So in this case, because it's a pandemic, we had everybody of the same mind. So for instance, the emergency use listing, which is what the vaccines are now authorized for, this is not something that was created for COVID-19. It was created before for such a time as this, such that if we ever find ourselves in an emergency or crisis situation, there must be a way to allow medication, drugs, diagnostics, testing tools to be able to be employed before going through the length of time. The crisis that we are in currently is that people are dying and that hospitals are being overwhelmed. Currently, as we speak, Delta is raging in the Caribbean. In Bahamas, hospital filled. In Jamaica, hospital, now we're talking about hospitals filled. They were out of oxygen. They had oxygen shortages. We have Barbados who are seeing their numbers going up. Grenada, who has been holding it down really well for the longest while they're back in community spread for the first time for months.
Right.
Right?
So we know that we have to continue the battle. The dialogues around living with the virus are very realistic then, because it's not something that we're going to be able to eradicate short term, although we do have legitimate means by which to attack it very quickly. That's what
Correct.
I'm hearing, yes?
Correct.
Now, you did mention in terms of young children being a new scope almost. With the advent of school reopening, new numbers are going to be looked at because now we have to look at vaccination of younger persons as well. There are legitimate concerns there, but I remember going to school and having to be vaccinated or immunized, and I need that distinction to be made. And then to appease the parents, of course, what is taking place there also needs to be explored. So I'll ask Dr. Tam Noel to start in the sense of vaccination versus immunization, the distinctions therein, and then perhaps you can both add to the conversation of how we're treating the younger generation of persons to be vaccinated. Dr. Tam Noel?
If I could just digress for 1 minute, when you were asking me about recovering of COVID, one thing I forgot to mention was post-COVID syndrome.
Mm-hmm.
So that people recover from COVID, but sometimes they call it long-haul COVID.
Okay.
They can have residual effects of that. So sometimes people may end up with prolonged lethargy. They've just not gotten back to their normal
Energy levels,
yes,
right.
and it's affected their functioning, their ability to do certain things. So it's not just a case of having had COVID and recovered from it, but we're seeing something now, the phenomenon of long-haul COVID. So the take-home is really and truly as much as we can do to not get COVID.
Right.
It's because you have to deal with a lot of people are dealing with residual effects of recovering.
Right. And one of the things we can do is vaccination.
Vaccinate. So the thing about vaccination, to actually come and get the vaccine, you're being vaccinated there. So in case of like AstraZeneca, it's a vaccine, when it was created, you have one dose, but you need a second dose within a period of about 8 to 12 weeks after the first dose, right? Now, you're not fully immunized. So the first time you got the vaccine, you were vaccinated. Then 8 to 12 weeks after, you go and get your second vaccination.
Mm-hmm.
But you're not fully immunized until 2 weeks after your second dose of your vaccine.
So in that window, you should be extra cautious.
Yes. So in terms of, so you may hear people, they may have had the second dose, whether it's AstraZeneca or Sinopharm or another vaccine, and they said, well, I got COVID maybe a few days after maybe my first dose or a few days after. But that window period, that 2-week period where immunization has not fully taken effect. So that time frame is important.
Okay.
In terms of people can still potentially get COVID even though you're fully immunized. But the whole process of the immunization, it's almost like a training. You have primed your immune system to recognize this virus. So if in the event this insult does occur, so your body has already made preparation to deal with it. You've given your body a head start, which is amazing if you have that facility.
Got it. So ultimately, giving yourself a fighting chance by fighting.
Yeah.
When we talk about students and younger persons, though, with the introduction rather of the vaccine to the younger generation, we've seen some challenges, and I imagine there will be some teething problems. But altogether, it is very normal that we have younger persons vaccinated to introduce them into regular society. Yes, Doctor?
Yeah, so we were all vaccinated as children. In fact, within the first year of life, we would have received at least 5, 6, probably about 8 different vaccines in the first year of life. And every one of those vaccines were followed up by a booster subsequently. So vaccines have been around. We have vaccines now, and vaccines will continue to be around for the future. And it's the purpose is understanding what benefit it brings, and it's a protection. So one, for a person who is vaccinated, though there's still a risk of becoming infected, that risk is much, much smaller than a person who is unvaccinated. 2, even if a person who is vaccinated contracts the virus, the risk of that person being able to spread it is still significantly less than a person who was unvaccinated. 3, once vaccinated, even if you get COVID-19, the chances of ending up in hospital, having severe COVID-19 and ending in hospital is significantly reduced. And then further, we know also, we've heard also about concerning death. The chances of death is significantly lower right now in Trinidad and Tobago. from the time that vaccines have really been available,
Mhm.
we've had the three deaths of persons who had been considered fully immunized. They had passed their period of time, and that accounted for only about 0.4, 0.3%.
Okay.
The number of deaths that we've had since vaccines have been available
Mhm.
has been 99.7% of persons who have
So
died
we're
have been
seeing the
unvaccinated.
actuality of it, that it actually does help.
It actually does help.
Now, there also is the talk of, well, yes, the booster shots being a possibility, but the different types of vaccination and perhaps mixing vaccines being consumed as well. What do you say to the persons who are unsure therein? Because it's not as if we had the option of picking which one we wanted to take. In some cases, it was what was available at the time.
Right.
So when we get to the point of needing booster shots, will that be a concern as well to denote which vaccine you had and would be only able to follow up with a similar version? How does that work?
So at this point, we don't, in order to determine the necessity of a booster,
Mhm.
you need to know how long immunity lasts.
Okay.
And at this point in time, since vaccines, the first dose of a vaccine, a COVID-19 vaccine, was given to a 91-year-old tanty, as we say in Trinidad and colloquial language,
Right.
in the UK. And that was on the 8th of December. So we just 8 months, 9 months throughout. So the research is still ongoing to
Right.
see how long the immunity lasts. And depending on how long it lasts and if it does wear, that would then determine at that point in time whether a booster is required.
Okay.
Some countries on their own are exploring that already and they are already making decisions concerning that.
Right.
But our guidance usually comes from the World Health Organization, who collates all of the data
Mhm.
from across the globe, not just, say, for example, the US make a decision based on US data,
Right.
but WHO would gather US data, Canadian data, European Union, UK data, Australian data.
Mm.
They would gather all data that comes to them and then assess and analyze and put the whole picture together to determine. So at this point, boosters are not a conversation from that perspective, especially also that as there are a large part of the globe who haven't even started getting first doses.
Right.
So
We're definitely ahead of the game. And we are doing so based on the support of the governments, of course, and the donations that are coming to us. So that you are a person who's experienced the full gamut. The struggles mentally, physically, the recovery and continuing therein. And you're now advocating for vaccination. So you say, what would you say then, Christopher, to someone who is still on the fence, not sure about whether or not they should get vaccinated?
Well, actually, I have been trying my utmost with both family and friends, using my story, as a possible motivator to get the message across. Because, as I said earlier on, having seen, being amongst others inside the hospital who weren't vaccinated, and me being singular in that aspect and having survived, at the end of the day, I cannot put words into right context why somebody would not want to give themselves the opportunity of survival.
And there you have. Giving yourself the opportunity for survival. That's the best way to put it. Of course, we hope that we've equipped you with enough information to decide not just about vaccination, but about caring for yourself and your family, and about the actual things that are happening within our medical community to make sure that we put our best foot forward. Any parting words, doctors, to make sure that persons are doing the right thing, making the right options, and at the very least making the best possible way for themselves? Dr. Otley?
So I would like to say that we're basically weighing two things, right? The potential of getting COVID-19, and as can be seen, it's almost inescapable. The virus will meet you at some point in time, and you want to have the option. Getting COVID-19, there's a risk of ending up in hospital with respiratory, with lung infection, clots in the lungs, clots in the legs, lung failure where you can't breathe at all, ending up on a ventilator, ending up in ICU, and ultimately dying versus having a vaccine and having that protection available so that if the virus meets you later on, you have your specific armory that is available there to kill it off as soon as it shows up. So and to mention long COVID as well. So there is great benefit to being vaccinated, and we in the hospitals system, in the medical fraternity, we've been battling sleepless nights, long days, and so we're looking forward to Trinidad and Tobago as getting to that point where the majority of persons are vaccinated so that we can now reduce the chances of the virus being able to spread among persons, resulting in more death, more sickness, and resulting in more lockdowns and so on.
Yeah.
So please, we urge you, we give you the evidence here. Please go and get vaccinated as soon as possible. No delay.
Dr. Tamuel, anything to add?
I just wanted to say that it's important, if you've not been vaccinated, that you ask yourself why, and that you make an informed decision. Not allow anybody else to make that decision or to impose pressure on you to not get vaccinated if you want to get vaccinated, or whatever decision you make. It's important you make an informed decision and you get the knowledge that you need to make this informed decision, because ultimately it is your life. And also, the more people who can get vaccinated, it lessens the risk of mutations. And the thing about viruses is they mutate, they change.
Right.
Often the changes are harmless, but occasionally there can be very serious changes that occurs. And that is what we're seeing with the Delta. So the more people who can get vaccinated, the more we can achieve herd immunity. There is less risk of such sort of serious variants occurring. So when you make a decision to get vaccinated, you're not only making a decision for yourself, but really and truly, you're making it for your society, for your community, for those around you too, and ultimately to your family.
Beautifully put. Now, again, it was a crash course. You've gotten a lot of information and you have a very, very significant choice to make. Decisions that impact yourself, your family, your community, and Trinbago at large. The hope is that you feel better equipped to do so. And to continue that trend, you can access all of the information we've delved into and more through our regional health authorities across the country, websites, clinics, and your neighborhood doctors and caretakers who joined us this afternoon. So thank you again for taking the time out from your busy and exhausting schedules to discuss this, and to Christopher for rehashing possibly one of the most traumatic experiences of your life. Thankfully, you are here today with us to tell us exactly why we need to continue to stay informed, to continue to have these discussions, and continue to use the resources that are available to us. Thanks again to the Ministry of Sport and Community Development on the programs like this, your TT Online Community Voices. Thank you again.
Thank you.